This is Adam from New York City, and I'm sitting right here with Ann. And Ann, what's your last name, by the way?
A-L-A-S, Alice.
Ann Alice. And Ann Alice is the lifestyle educator, and you're also the PA here as well?
No, nurse. I'm the nurse.
Oh, you're the nurse here. So you're the RN here, under Dr. Maurice Spear, and this practice here is a practice that does FirstLine therapy.
Yes.
And you guys got certified in October, right?
Yes.
I think it was October, yeah. And like everybody came from your practice. It was you, it was Matt, it was Dr. Beer.
Yes.
It was really great. And you decided to start utilizing the actual program not only in the practice here but for yourself.
Yes.
So what has the experience been for you in regards to this?
The first month was, of course, being, going from eating everything that I can, every sweet possible, to just starting the program.
Right.
The first week, to be honest, was, too hard for me.
Right.
But after that, I got it going, and I just said, I have to do this. And I lost weight. I went from 126 to 100 pounds.
That's wild. What was your dress size again? I love that.
I went from size 6 to size 0.
A size 6 to size 0.
And sometimes, I can't eat, some brand of, size 0 is still too big for me. And I lost most of it on my, my lower abdominal area and my hip.
That's wonderful. Oh my goodness gracious. You had mentioned that the patients are liking it within the practice. How's it going with the patients?
Actually, patients are noticing, I lost weight. And I don't even tell them. And they just say, Ann, you lost weight. What did you do? And I said, I went on this program that I got certified on. And they're like, no, I want to try it. I want to see. And I've had patients now that started on it. And they're very, very happy with what they have been doing. That's
great. You had mentioned a patient before who had some sleep issues and some other type stuff. Yes. Don't mention any names, but obviously,
I had one male patient who, he's diabetic. He takes, different medications for his diabetes just to control it. And one of his problems was, he gets up at night to take snacks or dessert.
Right.
And he craves in the middle of the night. And his problem also was, because he's getting up, he has trouble sleeping.
Right.
And the first week after doing the FirstLine therapy, and I made him write everything. I made him follow the time guidelines of when he should eat and, when the snack should be. He said that the first week he did not even once get up to get dessert.
Oh, great.
Sweet. And he said that when he wakes up, he said that he felt like he just came out of a vacation.
Oh, wow.
Even like he would take naps during the day, even for 15 minutes. He said he'd wake up, after that 15 minutes. And he said he feels so well rested. And that's the biggest thing that he noticed. And also, his, after a month of being on the FLT, his blood sugar has leveled off.
That's great.
And, he's still on the medication, just, because it's still pretty new. He just started.
Right.
But since, he's been on the program, he's been, we haven't increased his medication.
That's great.
It's still on the same, and he's been taking his blood sugar twice a day, and it's been, leveling off.
That's beautiful. That's really great. How's Dr. Beer? Is he enthusiastic about recommending this for people?
Oh yes, he sends me messages every day of the candidate to call.
Oh my goodness, that's great.
Yes, I get about 6 patients a day to call and get and get them an appointment.
Oh my goodness. So I'm so proud of the way you folks here have taken this on and the way you personally have taken this on. And it definitely shows. I walked in the door and I'm going, did you lose weight? And you had this funny look on your face like, I've heard that before in the last few.
Because I don't want to tell patient, oh, I lost weight. I don't, I get embarrassed.
Right.
When people ask me, did you lose weight? Or, you look great. I get so embarrassed. So I don't tell them. But then I've been with Dr. Beer for like almost 6 years now.
Right.
And, I've seen this patient almost, every week. So so they know me and they were like, what happened to you? You're like, you're so thin now.
Oh my goodness.
Yeah.
So like for other people who are in your position, the lifestyle educator, in this case you're an RN, but you're also the lifestyle educator here. Would you recommend that the lifestyle educator really takes it on themselves? Has it been helpful for you in really portraying this information to your patients?
Oh yes. Yes, big time.
That's dynamite.
Yeah. Mm-hmm.
Thank you so much. Wave goodbye.
Anytime. Anytime.
Thanks so much.